It's been a journey of excitement. It's been a journey of productivity.
Keystone gave us the ability to have accelerated change and the support to be able to achieve it.
So just dramatic results through the efforts of the Keystone Project and the evidence-based protocols and the process that was established by the Michigan Health and Hospital Association.
It's making our organization a better, a safer place for our patients.
Since 2003, Michigan hospitals have advanced voluntary and innovative efforts that have improved healthcare safety and quality and, as a result, saved thousands of lives and hundreds of millions of dollars. Michigan's dedicated clinical teams are preventing infections and harm to patients, delivering healthier newborns, improving communication and care coordination among healthcare providers, empowering patients to make informed healthcare decisions, and more. These pioneering efforts have resulted in unparalleled collaboration and sustained clinical improvements that are being adopted by hospitals and physicians throughout the country and beyond.
I think patients are very fortunate to be in Michigan hospitals because I do believe that they provide a higher quality, less risk care in entering. And I think the data of the last few years has shown that Michigan has made dramatic strides in creating a safer environment for the patients.
Since we've done the collaborative and we've followed the steps and we've standardized things, it really has helped us to improve our final outcome for our patients.
The changes in results from the Keystone Initiative have been dramatic within our unit. Our ventilator-associated pneumonia rate has dropped drastically. Our central line infection rate has dropped drastically. People are more aware of their everyday efforts and how that impacts patient care.
A massive voluntary effort by Michigan hospitals over the past decade has grown from small pilot programs to nationally adopted success stories.
In the 10 years that the MHA has established the Keystone Center, patients are much safer today than they were 10 years ago.
I don't think we'd be the same hospital if we didn't have this OB Keystone initiative. I think it raises the bar for us and the type of care and the expectation that really when a mother comes into the hospital pregnant, she has an expectation that she's going to receive the best quality and safest care. And indeed, we're going to provide that to them.
These quality and accountability efforts provide a foundation for Michigan hospitals to advance improvement in a meaningful, measurable way.
When you combine an organization that has committed to high quality and safe care, and on top of that, you give it an opportunity through the MHA, through a Keystone initiative, to gather data, to review the data, to measure the outcomes, to see the positive effects on quality and safety. That becomes very powerful to provide our community with safer, higher quality care.
The data results that we have seen from our involvement with Keystone has dramatically reduced the hospital-acquired infection rate in the medical intensive care unit. So again, it's really amazing the empowerment and the results of these checklists and consistent processes.
Even though change is an everyday part of the world we live in, having the courage to change the culture within an organization still takes a strong, bold commitment.
Culture change has been enormous. I think everyone is engaged both personally and professionally within the hospital and outside within the communities, all working together to understand the value of accountability for patients and healthcare providers.
Keystone has given us the ability to change, both culture and evidence-based practice, at a much faster pace, because Keystone allowed us to get consistent executive support and be there to network, to know what to do, and giving us tools on how to do it.
Changing the culture has really gone over very well because this team here in the operating room is very passionate about safety and quality. And in order to provide that safe care, everybody needs to be able to speak up and talk about their concerns. And that has just been really amazing to see.
We've been doing this long enough now where the collaboration and the Keystone efforts that we're doing are part of what we do now. It's part of the culture.
We found the results for the Keystone briefing and debriefing have been amazing. We have buy-in from the entire team.
Michigan's innovative and pioneering efforts have drawn national attention and are now being adopted by hospitals around the world. The MHA Keystone Center is expanding its work to further engage patients and families at all stages of their care and better coordinate care throughout the entire patient stay.
From Keystone ICU, we've been very successful, and we have virtually eliminated ventilator-associated pneumonias and bloodstream infections in our organization. Our hand hygiene compliance through the Keystone hospital-acquired infections has been at 95% and above now for over 2 years, so we're very excited about that. It's interesting because when we had the Keystone ICU and then we did the Keystone ED with the Lean Transformation Project, but each time a new collaborative comes out, the other folks in the organization, well, isn't there one for my unit too? That is because the excitement that it generated was wanting everybody in the organization wanted to participate with it. So that was just very rewarding and fun to see and what it means to our organization.
You know, I have always felt that we have given safe and quality care, but with Keystone and the initiatives that they put out there that we got on the bandwagon with, it's just become safer.
Errors have been eliminated, and evidence-based protocols have been put in place to improve the care and improve the outcome. That directly relates to those patients and their families and making sure that their outcome is what should be expected these days.
I think that through all the collaboratives and the focus on patient care, it makes us look not only at our data, but what the data means for the patients while they're here in the hospital. So does each patient experience anything negative while they're here? And so it really does kind of focus the data, so we're actually looking at patient experiences, not just numbers.
The Keystone Initiative is one of the major opportunities that I've had as a catalyst to provide safer, higher quality care for our community.
The Michigan Health and Hospital Association has been integral in this initiative. They've provided leadership and guidance, materials to increase education and awareness in the region and in the state, and we are very thankful for that leadership and what they've brought to us in this initiative for us to be more successful.
During this significant transformation of the healthcare delivery system, Michigan hospitals and health systems, thanks in part to the MHA Keystone Center's efforts, will remain unified around a single goal: to provide the safest, highest quality care to every patient, every time.